All right, so how did you hear about
I heard about Mark when I first started developing a receding hairline in my late 30s, early 40s, and I started doing my own investigations and realized that there was a new machine coming out that was the robot, the artist. I was very interested, started doing some personal research, and decided I was going to wait till that became FDA approved and consider having the robotic hair transplant. After about 6 months, once it was released, I reached out to the inventor, Dr. Harris, who's in Colorado Springs, and he informed me that there was a gentleman that he had trained, Mark, in close by where I lived, and so he gave me his number and his contact information, and that's when I scheduled an appointment to meet with Mark about possibility of the artist's hair transplant. And after that, obviously, a month or so later, we scheduled the first procedure. Right after my first consultation with Mark, he really, obviously from the very beginning, I was very impressed with Mark. Being a physician, I'm very particular about who's gonna take care of me as well. So my standards are set pretty high. Mark, from the very beginning, I was extremely impressed with. Even from the initial consultation, which was a Skype consultation, which for me, being the hours that I have, it's hard for me to get away from my practice. So we were able to go over everything, ask and answer any questions that I had, simply in my office in front of my computer, which was a huge perk because I didn't have to come and take time out of my office. Mark explained to me, very in detail exactly what would take place from start to finish, expectations from start to finish, and based on my, what I was looking for, what I was wanting to achieve with this type of procedure. He made me feel very comfortable about what I was about to take on, and so at that point we scheduled the procedure about a month later. Right. Well, the initial, obviously doing the procedure, the good thing about my profession is I do lots of surgery, so I was able to use, I was concerned about how I would, present myself to patients after the procedure. Obviously you have to shave your head to a certain degree, and there's a certain type of wound, the initial transplant's going to require you to have certain bandaging and so the good news is I could use a surgical hat, while seeing patients, and somewhat stay, discreet about my procedure, because I just really didn't, I didn't want patients to, when they look at you, the first thing, what did you have done? And so that was kind of a part, that was a benefit for me. But from the very beginning, from the initial surgery till after, it was a very, very painless, smooth transition. The way Mark pre-medicates you prior to the procedure is very sedating. It's very comfortable. It's a very long procedure at times, and I believe my first procedure was up to 12 hours. And so, that's a long time to be, seated in a position. And Mark and his staff were just great, and how comfortable they made me feel. And it was relatively a painless procedure. And that's really what I was really impressed about. And I had been, the more I'd read, some of the procedures, the strips type procedures were very uncomfortable. And so this was, I can tell you, was probably one of the easiest procedures I've ever had to have done. And not only that, but just the staff being so accommodating was really a nice perk. After having had the procedure, obviously, I've always been in health and wellness. I've been an athlete my entire life. I've always been able to kind of fix anything on me that could be physically, self-fix. Anything on my, without having to have intervention from a physician. Well, my hair loss was kind of one of those Achilles heels for me. And so, for me personally, the confidence I gained after getting my transplant and not having to, try to cover up the receding hairline has been really rewarding. You know, it's a staged process. It does take quite some time. It's not something you walk in and walk out of. It's 6 months before the final, 6 months to a year before you really find out your result that you're going to get after the initial surgery. So it's difficult as a patient because we want something immediately. I mean, we like immediate gratification. So, you know, once the grafts are put in place, they fall out, and then a new hair has to grow in, and that takes up to 6 months. So it's something that, you know, you look at and you kind of worry that, you know, what did I just do? The investment that I made, is it really worth it? But after the 6 months, you really are just kind of like, wow, you kind of start seeing the final results. And you know, everyone kind of has their, you know, everyone has an insecurity. You know, for me, it's always been, you know, hair loss, growing as, you know, advancing in my age. And so with the advent of this new technology that's out there, the ARTIS, which is a robot, which is, you know, mainstream medicine surgery is being robotic intervention, surgical intervention is extremely popular, and so it kind of takes the guesswork out of you know, extracting the follicles by hand or by eye. And so that was what really intrigued me mostly about the ARTIS, is that the precise precision that the machine uses in allocating the actual grafts and extracting them is what was really impressive to me. And but from a personal standpoint, I can say that it's just been, you know, really boosts your confidence level, and just as anyone would expect, that's had the male baldness syndrome, and it's just been real rewarding in that sense. What kind of stands out about Mark, and what I would, you know, from physician to physician to being on the other end of the treatment room as a patient, you really, you know, Mark has such a great bedside manner that, you know, it really makes you feel special, I guess, if you will. He takes he takes an exorbitant amount of time with his patients and explaining. The follow-up care, the phone calls, ensuring that everything's going well. His staff, who are extremely well trained in the procedure. It was a well-greased machine after I'd gone through it, and I can only say that Mark, you know, his personality along with his surgical skill, I can't imagine, you know, recommending anyone else to ever have this done. And I foresee Mark, you know, being you know, him becoming an icon in this particular technology because of not only his interest in the actual procedure, but his continued learning and his active interest in expanding and learning from this, because it's all new technology. And so, having talked with him just very recently, you know, the things that he's learning about the machine and how to operate it is only getting better and better. And so the end product is going to be a much quicker recovery time, a much quicker surgery than once it first started out. And for a patient who's getting a fairly large graft treatment that day, to be able to, once where it took 12 to 14 hours, now it takes only 6. That's a huge benefit to them from the time, you know, being away from work or whatever. And, you know, for me, what was the greatest thing is knowing I could do it on Thursday and have it be back in my office on Friday. So there was no downtime, and so that was what was such a nice perk. And it's just a really, I think it's, you know, with the technology and where it's going to be kind of, we're going to see more and more people who suffer from male baldness or female balding, you know, be investigating this type of technology and possibly having it done.
All right, great, thanks. That's basically it.